Hey everybody, I just wanted to talk to you today a little bit about low back pain, just getting ready to go in here and work out. And with regard to low back pain, it's really easy to begin to worry about low back pain and wonder if it's going to go away, and if it's something that you have to live with. And it can be really frustrating when you can't even stand for 5 minutes before your back is bothering you, or maybe you can't bend down to pick up your kids, or maybe when you roll over in bed onto a certain side, it wakes you up, and maybe you just can't do any of the activities that you really love because you feel like it's going to get worse, or maybe it does get worse with some certain activities. If this sounds familiar to you, stay tuned, because we're going to go over a lot of detail around low back pain and how to get to a natural, healthy solution that helps you get active, stay active, and live pain-free. I wanted to introduce myself. My name is Sarah Hanna. I am with One Accord Physical Therapy, the Valley's premier postdoctoral teaching and learning facility, where we specialize in getting people in their 30s, 40s, 50s, and 60s back to active living, staying active, and living pain-free. If you're worrying about low back pain, it's normal. Research shows that compared to like our knee or our shoulder or something like that, if we have low back pain in these areas, it's a little bit more common to worry about the back. We're not sure why. Maybe it's because we can't see the back, but we do know that it's more common to worry when you have a back problem. It's human nature to want to get an answer around why you have back pain, and what you can do about it. And because of this, sometimes we'll go out and we'll seek aggressive intervention, or try to find a solution, entrusting ourselves into the healthcare system, trying to get answers of why we actually have the pain. And sometimes we'll go in and we'll want to get an image right away, and we'll be asking the doctor to get an image. And this isn't necessarily the best course of action, because research is showing that if we do get an image before we get physical therapy, it can result in about $4,700 spent more that year because of unnecessary prescriptions. Maybe you get some injections, maybe you have a surgery, maybe you even have a fusion that you could otherwise have been avoided if you were to get a natural way to heal. There's a big influence on the spending with low back right now, and over the last couple decades, there's been a trend for increase in over $52 billion over a 2-decade period. And in 2013 alone, there was $67 billion spent on back pain and neck pain combined. So despite the increase in spending with some of the aggressive treatment out there, patients trying to get answers and everything, there's not a lot of good solutions or a trend for the spending to go down on low back pain. So what I want to talk to you about is what the research is showing, and then what we can do about it. How are we going to actually address getting rid of this back pain, and what are some of the things that we should do? Well, number one, you should know that back pain is common. Back pain is really common. It's 80% of the population will get back pain at one point in their life. And if you don't get back pain, it's actually rare. So getting back pain is actually common. And the good news is that 75% of back pain is going to resolve on its own. 75%, that's a big number. So 75% is going to resolve on its own. 25% will actually turn into what we call chronic, where it's lasting more than 3 months, and a more persistent pain. And the persistent pain, what the research is showing is that within this group, there could actually be some behaviors and beliefs. Maybe the person had real significant fears around low back pain and didn't want to make anything worse, so they rested a lot and they stopped all of their activities and just stopped movement. And maybe because of this, that's one of the reasons why it kept it around. And some of the beliefs and behaviors and actions around fear could actually be perpetuating the pain to turn to more chronic. So that's something we want to consider when we're treating back pain from a comprehensive perspective. But the really good news is that, again, 75% resolves on its own in 4 to 6 weeks. And then this is a really cool stat, 99% is not serious. Can you believe that? Like 99% is not serious. So 99% not being serious is great, because most people are taking aggressive action, I think, because they're thinking it's serious, right? What's serious? Serious is an infection, a fracture, maybe some type of cancerous process that requiring surgery. So the scary things, but 99% is not. And 90% is actually considered uncomplicated, non-specific, and that's the one that's going to usually resolve on its own. And that's really, really, really good news for us. So if you're having problems and a lot of this stuff is starting to resonate with you, and you just want to get a consultation and talk to an expert, understand how to get better, heal naturally, and avoid some of the unnecessary costs around low back pain, all of our experts here at One Accord are standing by, ready to serve you. And we have extensive training in spine care and rehabilitative processes that treat you from a comprehensive perspective to help you get active, stay active, and live pain-free. So click the link below. I invite you to get a free consultation with our experts. You can log on to our website at www.oneaccordpt.com and sign up for a free discovery session with an expert. I promise you it'll be one of the best decisions you've made all year, and you are to be wishing you did it sooner. We look forward to seeing you, and don't forget to stay tuned for next week when we talk a little bit more about low back pain. We'll see you soon.